and welcome to Module 7 lecture. This module is going to cover the last two chapters in your textbook, so chapters 12 and chapters 13. Starting with chapter 12, we're going to talk a little bit about gender and sexual orientation differences in relation to substance use. I wanted to start by first reading a quote to you that is found in the beginning of this chapter, and I just think that this is really interesting. And I think it's a very impacting quote. We need to let go of our damaging, prejudicial, unjust, outdated images and ideas about drug users, particularly women drug users who represent a heterogeneous, not a homogeneous group, in order to construct new insights and theories about their drug using and gendered experiences. And that was by Elizabeth Torrey. I think that this quote has a lot of meaning behind it, as far as, kind of first starting off simple, taking it a step back and saying, what does an addict look like? What is an addict? And then kind of even taking that a step farther and saying, well, what makes a female addict? Or, taking these labels and removing them is kind of, I think, what we need to do, or what this is kind of going into a little bit more detail about. I am personally not a fan of labels, and I try not to use those terms as much as possible, because they can be really damaging to those, especially the ones that you're labeling. So I just kind of wanted to share that with you guys, a little bit of perspective on that. This chapter does talk a lot about the stigma between gender differences in relation to substance use. Kind of starting with females are typically stigmatized for their inability to fulfill their gender roles, as far as, being the mother, being the caretaker when they're using substances. That's what they tend to be stigmatized for the most. Women also have a lot of barriers to treatment. Lack of childcare sometimes, lack of transportation, and the fear of losing their children to the system. Those are some common barriers that you will hear from women particularly. And they also talk a little bit about domestic violence. And, as we know, domestic violence can happen to anyone, but something to kind of point out in relation to females is that our culture promotes violence against women, with advertising, marketing, media, of women being tied up or being raped. We're seeing this on social media, and that's kind of portraying this message that, promoting this violence towards women. Something else to keep in mind too, when you're looking at designing treatment for women, or designing treatment for men, each of them are going to have different needs. Each of them are going to have their own barriers to treatment. Each of them are going to have, different circumstances. You almost have to treat them differently. And when you're working with substance abuse issues, it wouldn't be fair to say that, females and males both have the same issues or similar needs whenever they're going into treatment. Will there be similarities? Yes, but there are different needs as well. Textbook kind of goes on and, gives a lot more statistics and details. There's special risks for, males. And then it talks about the LGBTQ community as well. In the textbook, it's the LGBT, but it's LGBTQ. Those risk factors might include family rejection or victimization, multiple suicide attempts, using addictive substances to cope with stress, and being rejected by peers, for their, for being who they are. So a lot of these things are risk factors that could cause a person to want to use substances. I think that this chapter really breaks that down and kind of helps portray these differences that we may not normally take into consideration when we think about substance abuse. We just kind of think about it in a general sense, but there's a lot of different aspects to it. So this chapter kind of covers that. Chapter 13 talks a little bit more about some of like those laws, managed care, confidentiality, different things like that, welfare reform. It starts the chapter off by talking about welfare reform. I'm not going to get into too much detail on this. I do want you to know that managed care is its intended purpose is to help manage the cost of treatment for drug and alcohol for those who don't have insurance. That is the intended purpose for managed care. Um, Another thing that your textbook covers is like the law and ethical codes. One thing that is particular that I want you guys to pay attention to is the confidentiality of alcohol and drug abuse patient records, 42 CFR Part 2. You will see this in substance abuse treatment. What you need to know about that is that all drug records are confidential unless a person signs release. The only times that information can be, released without a release would be if, a person identifies child abuse, or if they are threatening to harm themselves or somebody else, if it's life sustaining. Those are the only two circumstances where you can release information without consent. Other than that, you would need assigned consent. The war on drugs comes back up in this chapter as well. So again, we've already identified what the war on drugs is. Pretty much what you need to know for this chapter with it is that Nixon uses this phrase to describe the drug epidemic, describing what is going on with the world of drugs. The authors go on to discuss mandatory sentencing for people who get charged with crimes related to substance abuse. There's a lot of information with that, and I didn't want to get too technical into that because there's a lot of facts, statistics, and different things, but just making note that that information is available. Also wanted to make note of, we again bring up that topic of harm reduction, and with this chapter, needing to know that needle exchanges are a part of harm reduction. They are a way to kind of reduce that behavior, reduce the spread of disease and stuff like that. So I want you guys to know that, or take that part of harm reduction from this chapter. And then the last bit of it goes into the pros and cons of legalizing marijuana. So the authors do give you an extensive list of what the pros are and what the cons are, so you can read through those. One pro that is particular to take note of is that if the legalization of marijuana was to happen and it was available in stores, the authors feel that people would be less likely to use harder substances because they could go to the store and get weed versus having to go to the streets for it. So that was one of their pro arguments for legalizing marijuana. Again, whatever your standpoint is on that, it's still something just to kind of review what the authors say and kind of take that into consideration. So at this point in time, you have officially completed all 13 chapters of addiction treatment in a nutshell. Again, we went through some of this material rather quickly and, for time constraints, but I hope that you were able to get something out of it and, learn something new, and hopefully not get too overwhelmed by the extent of information. Like I said, there is a lot of it, but just kind of, having that general understanding, I think will help you guys in whatever career choices that you choose from this point on. Well, I thank you very much for watching these module lectures, and I hope that they were helpful in your quizzes and written assignments. Thank you.